you all for braving the public to to come chat together and kind of return to open forum. I know Jacqueline and Randall have been to open forum. Is anyone else new? You guys new? Okay, welcome. Thanks for coming. I'm Dr. Peterson, and this is Open Forum, which is, I think we're in our 8th year now doing this. And so it used to be once the beginning of every month we would get together and have this health dialogue. Now we're doing it once a quarter. But the idea of Open Forum is I come prepared with a health topic to talk about, and I also kind of look at this as a dialogue and a conversation. So I want to talk about your health questions of any type, and I want to kind of, pause when you have questions. If you want to take the conversation down a different route. I don't have any prepared lecture. I don't have a PowerPoint. Have some notes I've taken, so I just kind of going to roll off of that, and I want you guys to get as much out of this as you can, or as you want. So I'm recording things, and so feel free to drop on our website if you want to watch it or share it with someone. And what I'll do in regards to the questions you may have is I'll write them all down just right at the beginning, and then when we're wrapping up, revisit them just so that we don't run out of time in case people are just wanting to stay for the main topic I've prepared. Should we kind of jump in, and are there any questions that any of you all have for me to go over with you? And it can be, again, just kind of anything health related. It doesn't necessarily have to be about chronic diseases or anything, but I just want to leave an opportunity. Yeah, go for it, Randall.
Can you make up sleep? If you've been sleep deprived for a long time, and then you sleep a little longer for the next couple months, can you actually physically make up what you've lost?
Yeah, making up sleep, sure. Probably a debatable topic. I'll give you my opinion. Okay, cool. What else? Anything else? You don't need to think any up. I mean, if you don't have any, it's cool. We can just jump into things.
I have a quick question.
Yeah, please.
Do you have ideas how to help patients who don't have a lot of financial support make better choices with food or vitamins? I have patients that just don't have the means to always purchase things that may be more healthy for them.
Yeah. Yeah, sure. So I'll just write health and finances. I just jog my memory. Cool. Yeah, I'd love to go to that. Awesome. And I guess, too, for those of you who didn't come with Dr. Karen, I wanted to introduce you guys to Dr. Karen. We're so happy to have her as a new physician at our clinic. So she's just kind of getting a hang for Open Forum, and I'd welcome you to kind of contribute when we get to these questions. Anything you have to say too. So.
I already have one question.
All right, you got a question?
Was your #1 anti-aging tip?
Anti-aging tip?
Yes.
Okay, sure. I guess it would be helpful to define aging a little more specifically.
That's true. Maybe like skincare and all that.
Okay.
Wrinkles and the stuff we don't want.
Yeah, right. More aesthetic.
Besides, drink lots of water.
Okay.
That one.
You know that one. Okay.
I know
good.
that one.
All right. Cool. Okay. Sure. All right. So today's Open Forum, I wanted to bring up a topic that I think is really important for us to be more aware of, which is the presence of chronic infectious diseases in our population. In my clinical practice, I personally treat a lot of folks that have chronic infections as either a contributor or a small or large contributor to limitations in their health. And I really feel that there are very few resources for recognizing that in the conventional setting, as well as assessing it and then treating it. And so as naturopathic physicians, we end up having a lot of these folks walk through our doors, maybe because they've been to a lot of people with no answers, or because their symptoms don't fit into a tidy diagnosis or don't have a pathology that can be easily recognized. But chronic infections are definitely a real thing, and I've seen firsthand the assessment and treatment of them to be very helpful in freeing people's health and really removing a lot of chronic symptoms and complaints. So today I want to kind of overview some of those chronic infections, of what they are, how they present oftentimes, how you can work them up and assess them to come up with a more formal diagnosis if that's possible. And then from there, how do we understand how to treat a person so that the chronic infectious process isn't so limiting to their health. And so I kind of brought up, in my mind, some of the primary conditions I wanted to talk about. I was curious from the people in the audience if there's any specific conditions you want to make sure we spend time on, or types of chronic infections. Is there anything that specifically jumps out to anyone that really want to make sure we tackle?
Besides what was on the title?
Yeah, sure.
Just the ones in the title.
Okay, sure. Yeah, good. So, and I have a few more beyond the ones on the title too that I wanted to touch in on. So maybe we should just spend a little time. I like to kind of zoom out and then zoom in. So, like, what are the ways in which the body can be unwell or limited, or can basically have disease inhabit it? It's not one single source that creates that, right? Infection is one thing that can happen to our health, but there's all sorts of issues that can come from cancer to inflammatory disorders to nutrient deficiencies to genetic disorders to mental health disorders. So, you know, many things happen to our health to limit it, but infectious disease is very much one strong and important category, as we're all very acutely aware of right now going through pandemic, or a pandemic. And so in that realm of infectious disease, the most common way we think about it is really acute infection. A coronavirus would be an example of an acute infection. You either acquire it or you don't acquire it, and you either survive it and become completely well, or you don't and you die. I mean, that's a really blunt way of saying things, but that's kind of how acute disease works. And acute infectious disease has been with human society forever, basically. I mean, we've always had them, and it ends up killing a lot of people, and 99% of the time we get better, and the infection is gone, and we've cleared it from our system. So in the conventional medical setting, this is primarily how we understand infectious disease, that you acquire it, the symptoms come on rapidly, the body fights it off, we may have medicines to help that, and either you recover fully, fairly quickly, or you don't and you die. And so that can happen anywhere in the body. It can happen in the sinus passages, it can happen in the lungs, it can happen in the urinary tract, it can happen on the skin, it can happen in the gut, right? So microbes can inhabit or infiltrate our system really anywhere on our body. And the idea there is that substances or I guess organisms that are foreign to us, that are not part of our tissue, actually use our tissue kind of as a petri dish to reproduce and expand, and in the process can be destructive to our own tissues by creating toxins, creating byproducts of their reproduction and die-off process and metabolism process that can be harmful to our organism. And so, again, our body has co-evolved with these things because they've been with us for thousands of years. So we've actually, adapted really sound methodologies to deal with infectious disease, and we have this actual whole system in our body called the immune and lymphatic system, which are very much one of the primary central roles of them is to protect us against and eradicate infectious disease compounds that infiltrate our body or that are trying to. There's kind of two parts to that. There's what's called the innate immune system, which is a kind of universal reaction to microbes that is not specific to individual pathogens. And that exists on our skin and our mucous membranes and our gut. And then we also have a more adaptive form of immunity where we have this ability to create a unique individualized response to specific DNA or kind of imprints on specific microbes. And so everyone's very familiar with vaccines. Vaccines is an example of essentially stimulating the body to preemptively create an adaptive individual response to a specific microbe, so that when the body gets exposed to that microbe, it can quickly exterminate it and remove it. That's the whole premise of what a vaccine is. The body has its own methodologies to do that, of course, without a vaccine, but it takes real live exposure to the microbe to do so. So I keep talking about infections, pathogens, like what are these things? The primary things that I'm going to talk about today, and that in the Western science world we're familiar with, are viruses, bacteria, fungus, and parasites. So those are kind of the four categories of the animal kingdom that can get into our body, and each of those types of infectious compounds carries different traits. Viruses, mold or fungal infections, bacterial infections, and parasitic infections. And there's a wide variety in all of those categories, and they all can arguably affect many different tissues, and they can present in many different ways. And part of the trick with infectious disease is actually determining the underlying type of infectious disease you're dealing with, thereby allowing you to know what kind of medicines that microbe is susceptible to, or which part of the immune system you need to stimulate to kill that microbe. And so, it's important, I think, to have this appreciation with these pathogens or these microbes that we live in commonality with, not commonality, we share space constantly with microbes. They're all over the place. On our skin, there's millions of bacteria and fungus and virus on it. On this table, there's hundreds of thousands of microbes on it on the tip of this pen, right? So they're everywhere amongst us. We're breathing them in constantly. We are swallowing them. They're rubbing off on our skin. They're in our hair. They're in our airway and our lungs. They're all over our gut. In fact, there's 10 times more microbes that live in our gut than there are cells in our body. I did a whole lecture on, it was called 10% human, 90% bacteria, because that's, from a cellular standpoint, what we're made of. So it's very important, I think, as a just, kind of person out there who doesn't have a scientific training, to understand that bugs are not bad, and they're not something that we need to, in our mind, think we somehow have to avoid and isolate ourselves from, which I know is maybe a really hot button thing to say amongst the coronavirus pandemic. But it's just to say, in all practicality, we're constantly being exposed to all sorts of viruses. And we're not sick all the time, which means that our body has a very intelligent way of identifying and preventing viruses from spreading and becoming dominant in our tissues. And I would even go so far as to say is our very health depends on the existence of these microbes, especially when we talk about the gut and the connectivity between the microbes that live in the gut and the assimilation and breakdown of our foods and the health and intelligence of our immune system. And I've lectured a lot on this topic, so I'm not going to get too far into that today, but just to say, we really, as we're talking about infections being a bad thing, quote unquote, as a topic, then we really should also remember that these bugs have a very important role to play in our health. So, and we're constantly immersed in them, and yet we're not sick all the time. So that, when we get to the treatment part, we need to kind of square that loop in some way to say, why is it that some people get sick and others don't, if we're all being exposed? And so, again, I think very appropriate to pandemic conversation too. So any questions so far, kind of just as I'm laying things out? Okay, cool. So then let's kind of talk about the places or the types of chronic infectious diseases that can occur. And let me clarify when I say chronic. Anything that's acute or subacute, we typically see resolving anywhere from 12 hours. Some people have had stomach bugs that last about 12 hours, to maybe a month or so. That I would call that subacute. What I'm talking about with chronic disease is things that are months, probably years, maybe decades, and the existence of these things as part of someone's health picture. And it's a little challenging because there's often a lot of other stuff going on. I mean, that's the tricky thing about chronic disease. It's a puzzle. It's very complex what is contributing to someone being unwell. As a naturopathic physician, probably spend 90% of my time treating chronic presentations of illness. And I think there's a couple of reasons that happens. I think one is that as our modern conventional medicine has gotten better at treating acute disease, we have antibiotics, we have some really amazing battlefield medicines that have truly extended our lifespan and reduced death from acute disease. So we live longer, and we tend to develop more chronic ways of being limited in our health. So that's one thing. And another thing is, in the conventional medical world, most of the both diagnosis and treatment is really not suited to chronic disease. So in other words, many chronic diseases or chronic health limitations, I'll just say, do not have pathological findings in blood work or physical exams or laboratory testing or evaluations. Everything is normal according to the conventional standard of care. So yet the patient feels very unwell and very limited in their health expression. So a lot of times they're not given answers or approaches there. I also think that the tools in conventional medicine are not designed to build health. They're more designed to suppress symptoms. But unfortunately, when you suppress a symptom and you don't treat the underlying cause or do the detective work to find the underlying cause, then once you remove the suppression, the symptoms return, or if you're suppressing it, the body finds some other way to express that there's something causing dysfunction in the body. And so I think that's another reason where naturopathic medicine is so helpful, because my approach is very much, I see myself as that detective wanting to put the puzzle pieces together and really dig into what is the mosaic of things going on in this person's life and health that is leading them to feel limited in suffering. So in that chronic disease world, that's largely what I see, and a lot of the folks have been to one, multiple, 20 doctors before they're coming to see me. And so, a lot of stuff's often been tried. And so one of the things that I see missed a lot in that kind of setting is chronic infections. So I kind of want to go into some of the ones that I identify as things most commonly presenting. And I'll probably start with the chronic infection that people might think most about. Not necessarily in our region of the country, it's much more epidemic in other places, but it's here, and it's called Lyme disease. So Lyme is one of those interesting infections. It's technically not any of the four things I said. It's called a spirochete, which is like in some ways in between a virus and a bacteria. But Lyme disease is actually the spirochete is transferred to the human through a host, which is a tick. So in the classic medical sense, Lyme disease is acquired when a tick bites you and actually, penetrates in through your skin layers and basically spreads that spirochete into the bloodstream. In conventional medicine, the way we associate Lyme symptomatically is you get this, what's called a bullseye rash, this redness followed by a ring of white and then redness beyond that. And so that rash is a classical finding of the potential of the Lyme spirochete infecting the person. And so what will be done conventionally is when a tick bite happens, there will be probably just prophylactic treatment with antibiotics, followed by perhaps an assessment of a couple of different blood markers, which there's two different ways it can be done. ELISA and Western blot are the kind of standard 1-2 testing. And what that's really trying to pick up is an immunoresponsiveness to the specific Lyme spirochete. So it's actually looking for an adaptive immune response there. And what can happen in those symptoms of having a Lyme infection is like many infections. It can be flu-like symptoms. You can have fevers, chills, fatigue, malaise. And again, these are the types of things that usually will present in more the acute phase. Remember, we talked about acute versus chronic. Oftentimes, none of that will happen. They won't get the rash. They won't necessarily have the initial symptoms. None of that will show up. And over the course of a very long time, someone may begin to develop more chronic, kind of hard to pin down symptoms. So they may have fatigue. They may have joint aches and pains and arthritis developing. They may have brain fog or memory issues or speech issues. They may have neurological issues, changes in smell perception, changes in hearing, numbness, tingling, paresthesias, these very strange symptoms. And of course, lots of diseases and lots of conditions can cause these things, and they may not present all of those together. They may just present some of them, or they may just present one of them. it can be a really tricky thing to pin down. But generally in my clinical experience, when I see a lot of neurological symptoms, especially if they come and go, rather than constantly being there, if joint symptoms are there, and if there's a time where they were never well since a certain time, even if they do or don't remember a tick bite, and there's no real big emotional trauma or, inciting or stressful event, then I kind of wonder about Lyme, and I always ask, where have you lived? Tick bites, those are kind of some of my questions. And I often will be thinking about geographical information there because Lyme is epidemic on the East Coast in the Midwest and to some degree on the West Coast, but on the western edge of the states, so like Washington, Oregon, a little bit in California. But the East Coast very largely, as well as the Midwest pretty strongly too. So that's very much important when taking a history to understand that. Because it's very possible that in part of their life long ago, they acquired that infection and it's presenting and causing issues in their health now. So any questions about kind of what Lyme could present about and kind of the acute versus chronic? Okay. When we work up a suspicion for Lyme, I will, if insurance will run it, I'll sure do the ELISA Western blot, which is the kind of standard conventional assessment. However, when we talk about testing, we have to use these terms sensitivity and specificity. So specificity is, will this test definitively rule out this disease being existing? So that's the specificity side. So you can have false positives and false negatives. So if it's highly specific, it means that if it comes up negative, then we're pretty sure you don't have it. And then there's sensitivity, which is how accurate is the test at picking things up. So if it's not very sensitive, that means you could get a lot of false negatives. You could do the test and say, oh, it came back negative, you don't have it, but the test is not reliable enough, sensitive enough to pick up all the individuals who are positive. And so with chronic Lyme disease, there's a big issue with the conventional testing in that the sensitivity is not very high in a lot of experts' clinical opinion. So arguably half of the cases that tests that are negative on those standardized tests are actually positives. And so that's something that is unfortunate because people also might get a test and be told they don't have it when we go do more advanced sensitive testing they actually do. So there's a company that I work with called IGenix that does very accurate, very sensitive testing. And that's really valuable to know that there are some much more precise labs. They're a little spendy, but if you have chronic health conditions, it can be pretty worth it to really figure this out with certainty. Yeah, go ahead.
Just out of curiosity, is it possible for someone to have Lyme's disease but not have any symptoms ever?
It is, yeah. And with all of these conditions, that's very true. And I'm going to speak to that a little bit in terms of my appreciation of infectious disease more broadly in terms of what allows it to thrive in some individuals and not in others. So it can. The other thing about Lyme, just to make things a little more complicated, and this is where you get the sense that, wow, this is complicated. Maybe you should be specialized in this to treat this. And indeed, there are thousands of practitioners that are Lyme specialists who really focus their clinical practice entirely on Lyme disease because there's so much to understand. One of the things that also is tricky about it is those ticks can not only inject Lyme spirochetes into the bloodstream that can create infections, there's also a lot of co-infections that can come with it. Bartonella is one of the most commonly known, but there are all sorts of really funky, weird bacteria, spirochetes, viruses that can kind of co-infect with Lyme. and they can often present with different symptoms. So again, if this was a lecture for a bunch of patients with Lyme disease, we'd probably go into a lot of depth about that and really get to talking about some of those individual things. But for the purposes of this, I'm just going to say that it's a pretty complex thing to work up. And in the conventional world, there's no acknowledgement of these co-infections. It's like not even part of the conventional medical knowledge basis. So nevertheless, I've tested people for these. I've seen positive infections. I've treated them directly and seen it to make a real difference in health. So I know that they very much matter and they're worth working up if a person presents with some of these chronic Lyme symptoms, to go for the whole picture and not just testing the Lyme. So any kind of questions about testing and workup? And this is a blood test, of course, the workups for Lyme infection. Okay, so I'm actually going to go through each of the conditions I want to talk about, just sharing clinically what the symptoms look like, how we might assess if indeed scientifically confirmed it is or isn't present. So that's kind of, and then I'll move on to kind of treatment in a more broad sense versus individually to each infectious disease, because there's some very broad principle to apply across the spectrum. I'll also mention another subset of practitioners. So you have the conventional doctors that often don't have sensitive enough tests or aren't even aware of the scientific tests that exist. That's an issue, but in my opinion, you have an issue on the other side of the equation, which is some of, in the more alternative world, practitioners who do diagnostics for chronic infections that don't really have any basis rooted in any Western scientific model. So there's no conventional testing protocol, there's no studies that have been done. We think of a lot of these methodologies being done with like what's called muscle testing or magnet therapy or various different intuitive forms of testing. My concern about those is not to say that there's nothing to that, but I think in those settings, what we find is that practitioners are relying on intuition. And I'm the first to say that intuition is one of the most powerful tools we have in guiding our survival in the world and in well-being. And I use my intuition every day in my clinical practice, and so does every doctor, and as much as they want to deny or rationalize, they don't. But to use intuition to make statements about such weighty things as chronic infections, I think is problematic. And the biggest thing that I think is problematic about it is it's a reproducibility issue. So if you're going to give someone something to latch on to and believe and rally behind financially or protocol-wise, and there's no reproducibility to it, I have a tough time from an ethical conscience standpoint to really offer and validate those kind of methodologies. And so, for example, if you do the IGeneX Lyme test and you run, someone's blood 5 different times, you're going to get the same result 5 different times, 99.99% of the time out of 100. Whereas if you have 5 different energy work, intuitive practitioners assess a patient, I find it highly unlikely that they're all 5 going to come up with the same positive or negative diagnosis, or is this the same thing? And so that's my concern about those methodologies, is it's hard to see the reproducibility be there. And I'm not saying that some people have not honed that to a deep degree where indeed they are pretty accurate and they can dramatically help most people they work with. It's just not my personal approach to things at this point in my career. So I want to put a little statement in there about that, because even in this community there are actually a good number of practitioners in the healing arts that patients come to me saying, I have Lyme disease. Oh yeah, how'd you get it diagnosed? Oh, someone put some magnets on me and told me I have Lyme. And so I treat that a little differently than if it's like I have a positive serological test for Lyme disease. Sounds like someone is cleaning the wall. Or hopefully not graffitiing the wall. So let's go on to our next condition that I wanted to talk about, which is Epstein-Barr virus. You're probably more familiar with this as mononucleosis or mono. It's often referred to just in general terminology as like kissing disease. But the thought about, again, conventionally mononucleosis, it's also the virus, it's a virus, it's called Epstein-Barr virus. And the idea with mononucleosis is that it's seen in the conventional world more as an acute illness or acute disease. So you see it traditionally in younger folks who tend to be the ones acquiring this. College age, high school age is oftentimes where you'll see this. It's pretty communicable. And its classical symptoms are, a lot of the same viral infectious ones, flu-like illness, malaise, lots of fatigue. You can get major lymphatic swelling, big honking lymph nodes in your neck and your armpits. You can actually get swelling of your liver and swelling of your spleen. That's a quite common finding. And the swollen spleen, and of course the spleen is an immune organ, so in some ways that makes a lot of sense. The lymph nodes are immune organs. And it can last a good bit of time actually, even in the conventional setting. You can have to treat Epstein-Barr for quite a while. Of course, because it's a virus, this is a place where conventional medicine doesn't have a lot to offer. We've talked about, bacterial infections, like even a spirochete is a form of bacteria, and you can treat Lyme disease with antibiotics, but viruses don't have many conventional treatments. There are some drugs that have been developed. They tend to not work great with most viruses, and they tend to only work if you catch them really early in the progression of the virus. So mononucleosis is kind of one of those infectious diseases where conventionally if you acquire it, it's just we diagnose it and then we kind of support the patient and monitor them and kind of treat the symptoms of it. We don't really have good ways to kill the virus conventionally. So those being some of the symptoms we might see in the acute setting, and then usually there's a resolution and we think, well, that's it. That's the only way we have to deal with Epstein-Barr. It turns out that Epstein-Barr can very much be a chronic player in someone's health. And the symptoms I see that I might link or attribute to Epstein-Barr are going to be definitely chronic fatigue. So some of these folks with chronic fatigue syndrome, fatigued all the time, never well since this time I got sick. Epstein-Barr should be on our radar for something potentially being in the picture there. Chronic weird lymph issues, lymph node swelling. You can actually have chronic swelling of the liver or spleen as well. Those are the types of symptoms that may come along with it. Headaches to some degree can be there, but the fatigue is the big thing that I think about, the chronic fatigue and the weird lymph stuff going on. So let me see if I made any other notes. Yeah, those are the biggies. So, go ahead, yeah.
So when you're referring to like the organs being swollen, what kind of symptoms would that like?
You could have discomfort in your abdomen because the spleen's right here, the liver's right here. You could have a literally palpable mass in your abdomen.
Not like stomach ache, just like
you can
pain.
in pain. Yeah, in pain. You can actually get jaundiced because you're essentially backing up your liver and spleen processing of red blood cells. You can have elevated liver enzymes. That can be a sign. You can have issues with platelets and blood counts. So those are things you can kind of monitor as you're treating an acute infection or identify in a chronic infection. But the real way you test for it chronically is you look for antibody counts. And Again, remember we talked about the adaptive immune system. So the adaptive immune system is when the body has created a specific response to the pathogen it's been exposed to. And then one of the specific responses it creates is what's called an antibody. And we can go and measure those in the blood. And so that's a certain immune molecule, it's called an immunoglobulin, that basically binds up that pathogen and flags other molecules in the immune system to come kill it. And so we can do, to make it more confusing, there's different types of immunoglobulins. There's some that are produced at the initial infection. There are some that are produced during a chronic infection. So typically with chronic Epstein-Barr, we're going to be predominantly measuring the chronic titers or quantities of immunoglobulins based on the chronic infection. And those are called IgG immunoglobulins. So when you run a lab test for Epstein-Barr and you're looking for kind of a chronic presentation, you'd be measuring those IgGs. I often will measure the IgM, which is the more acute phase, to see if the virus has become more activated again and the immune system's making more acute phase antibodies to it. But the thing about that that's a little tricky is if I actually go and test people, when I've done this plenty, it's hard to find someone who doesn't have positive antibodies to Epstein-Barr. And so then you get into this question of, well, should I test it if, everyone has them? And I have found clinically that the burden, the total quantity of antibodies makes a difference. So if someone has, 80 times 10 to the 6, quantity of IgG antibodies, that's very different than someone with, 10,000 IgG, 10 to the 6 factor antibodies. So quantitatively, I pay attention there, and that's why sometimes I actually will run those titers. Also, it gives us a baseline so that we know as we treat things, are those antibody titers going down? So having a baseline in any infectious disease or really any blood-related issue is nice to be able to track over time. Clinically, we track the symptoms. Laboratory-wise, we track the numbers. So that's one way we can do an assessment is through blood, looking at the immunoglobulins or the antibodies. Yeah.
Do those IgG numbers fluctuate over time if you've had the Epstein-Barr, or do they, if you've had it, do they stay at a constant for your whole life? You hear sometimes that once you've had mono, you can't get it again, or whatever, So.
Well, that's just it. So my argument of those antibodies being there is that it's a muddy picture. It's not entirely clear to tell whether you still are hosting the microbe or whether you have immunoglobulins, but your body is free of it. My argument that I would make is that with most infectious diseases, there's an ability for that virus or bacteria or fungus to reside somewhere in the body always. And it's whether or not the immune system is keeping it in check or not, or keeping it from proliferating. That's an opinion that's not based on any confirmatory science. So again, the levels of circulating antibodies and their fluctuation could really kind of give you feedback as to how active that virus might be in the body.
So your symptoms could flare up if your antibodies drop.
Or actually flare up if your antibodies go up.
Go up.
Because that means the immune system's more active against it. Yeah, but it's a very murky picture, which is why we can't always rely on the labs. I mean, and maybe conventionally they would argue that same argument is that, well, the labs are not black and white, they don't give a really clear picture. So I tend to not rely actually, especially with Epstein-Barr, very heavily on the labs. But sometimes if the symptoms, that we're discussing are really prominent and the patient's really wanting to try to grasp at, can we understand some of the things contributing to these symptoms, that might be a worthwhile panel to run to get a baseline and assess, is there a serious antibody elevation or is there minimal? Now in the acute setting, you can actually do some other testing, but again, it's mostly going to be immunoglobulins that we're going to be worried about. So in terms of presentation, testing, everyone good on Epstein-Barr? Okay, cool. So again, an important one to mention because I see it show up. I also see it come up with some arthritis issues. Sometimes I see immune inflammatory arthritises have Epstein-Barr as a significant component. Yeah.
Are you going to get into treatment too?
Mm-hmm.
Okay.
Oh yeah. So I'm going to do it more as a generalized sweep, in which so I'm going to kind of individually introduce the infectious diseases. Herpes virus, the other one I think I mentioned on the topic, is Herpes Simplex. There's a herpes family of viruses, but Herpes Simplex is technically Herpes Simplex virus 1 and 2. And so those are the ones I'm going to be focusing on. There's also Herpes Simplex virus 3, which is the one that does chickenpox, and a couple of other ones that I'm not going to mention that are more childhood illnesses. They don't tend to present in adults a lot. But Herpes Simplex 1 and 2 do present in adults. And the main thing we think about herpes virus is it attacks the nerves and it attacks some specific tissues. So the two primary tissues being attacked is the mouth. And so, you know, the term cold sore is often attributed to the presentation of an active herpes expression. And then, of course, that herpes virus can also present in the reproductive tract in males and females. And so those will often present as skin lesions, red raised bumps. They can actually open up into blisters. Everyone presents a little different. Some people, they won't present visually at all, but they will very much feel pain or discomfort in specific nerve, what are called dermatomes, or nerve roots that move to specific surfaces in the body. So the herpes virus is transmitted through contact, and it's typically transmitted through contact, direct contact, when the virus is actively shedding. So in other words, like if you have a positive diagnosis for herpes virus and you're not actively shedding, you could have intercourse, or you could share saliva, or touch mucous membranes and not get infected. It's really when the virus is spreading that we have to worry about it. So, or shedding, and we don't necessarily know when that is. But obviously when someone has an active sore, it means it's shedding. So again, the presentation symptomatically here is pretty clear cut. Actually, this is the most normal chronic disease, though, the ones I'm going to talk about, because it's well known even in the conventional community that herpes virus 1 and 2 presents chronically for most people. It's very rare that you get one cold sore and you never get one again in your life. Another thing to know about it is it can be transmitted transplacentally, or mother to child, which arguably is true, arguably about Lyme, although there's not a lot of clinical evidence or scientific evidence. But this virus can be transmitted that way, so you could just be born with the virus already inhabiting your tissues. So the symptoms obviously are the sores and the very neuralgic pains that are kind of usually, they can be sharp and shooting and electric, or burning. There's a lot of different ways patients will describe them. They'll often present with open sores, and they can be with people for the rest of their life. And typically this is very common too. Almost universally people will say stress brings them out, the sores, psychological, emotional stress largely, but sometimes physical stressors. So people might say, whenever I have peanuts, I get cold sores, or I get a pelvic outbreak of sores or pain. And there's an argument, a theory that arginine and lysine, which are amino acids. Arginine's heavily contained in nuts and seeds and chocolate, can tend to make someone more predisposed to actively shedding the virus and the virus activating the body. So in this case with herpes virus 1 and 2, herpes simplex, we know that really this is a situation of the virus chronically being present. It's always there. And that when it's active, it creates symptoms. And so it's interesting the conventional medical community accepts this chronic viral setting, but many of the other ones it does not. So once you acquire it, of course, it's there for the rest of your life. I have plenty of patients who have tested positive that have no symptoms, to Jackie's question of can you have this without any symptoms? Yeah. And people, again, who have had a partner, sexual partner, say a spouse that has herpes virus, could maybe never ever present any symptoms, even though clearly they've been exposed to it. And again, that gets into why do some people get infected, or why do some people show symptoms and some don't. In terms of conventional assessment, conventional assessment's very similar to how I would assess it. You have the symptoms to go off of, but then you also have serological or antibody testing, which can confirm the presence or absence of antibodies to the virus. You then actually have tissue sampling you can do too. So you can actually go assess like one of the cold sores or something and analyze it for herpes simplex 1 or 2. And they are different viruses, but I'm not going to get into the semantics of that. Essentially, you can have 1 or 2 both in the mouth or the genital region. So it's not, to me, clinically that important to differentiate between the two. And the way I would treat it, it wouldn't matter whether it's herpes simplex 1 or 2. So again, I bring that up as part of the chronic disease picture just because a lot of folks end up having this and they actually are treated conventionally. There is a acyclovir or valcyclovir. There are a couple drugs that can keep this at bay and seem to stop the viral replication in the body. I have other tools that I think work really great too, and looking at the root cause of it as well. So, any questions about herpes virus? Okay, cool, pretty straightforward one. The other ones I wanted to talk about, so I definitely wanted to leave a little space to mention mold, because this is again a thing that is vastly, very poorly understood in the conventional setting, very underdiagnosed, but can really be harmful for folks' health. And again, I feel like we're a little luckier in the region we live in, that we live in a relatively dry climate. Mold really likes wet places. So, we think about when babies get, yeast infections that tend to happen in very moist places. Diaper rash is often a yeast or a fungal infection. So places with more moisture, mold likes yeast. All infections compounds like water or like kind of wetter environments, but mold seems to be particularly common in this way. And the reason I bring that up is because what we're really talking about with chronic infectious mold issues is basically mold being in our environment insidiously or in a hidden way, and us constantly being exposed to those mold spores or the toxins the mold is creating. So with mold, it's a little different in that a lot of the things we're concerned about is not necessarily harboring a mold infection in our body, although that can definitely happen, but actually the spores and the toxins from the mold getting into our mucous membranes, our airways, our tissues, and creating a lot of dysfunction. So symptomatically, how this might present, again, it can be very broad in its presentation, but the things I most commonly think about are chronic sinus infections, chronic congestion, recurrent lung infections or weak lungs, again, swollen lymph nodes, always that possibility because that's an immune organ. Brain fog, a lot of disturbed cognition, thinking, a lot of fatigue. And I guess you guys are hearing a theme here, right, in terms of these symptoms. They all overlap because infection can be masquerade pretty similarly symptomatically, even with different infectious sources. But as we all know, if you give an antibiotic for a fungal infection, it's not going to do anything. So this is where it really matters to know what type of thing you're dealing with, because our tools and approach are going to be different. So clinical symptoms, that tends to be a lot of what I look at. And again, right, we're not talking about acute mold infection like, a skin infection of candida or something, or a yeast infection vaginally, right? Like those, I guess, can become chronic, but I'm more talking about systemic kind of things that can last or be with people for years and years. Allergies can also be associated with mold because the mold that's insidiously, chronically bothering the body can really distort the immune system's response and intelligence. So sometimes when we see that, we also have to think about allergies, we have to think about mold potentially. So testing-wise, if we want to actually go out and test for it, this is one of those places where we actually have to talk about environmental testing. So oftentimes these chronic mold issues will be caused by a chronic environmental exposure. So again, lucky where we are here in that, we have a pretty dry climate, so we don't have things constantly wet, which is where mold really likes to grow. But these things can happen, especially when there's water damage to our homes, to our places where we live. Certainly when there's certain types of construction designs that aren't very good, they're actually good at keeping moisture out, but when moisture gets in, they lock it in. So vinyl siding is, notoriously problematic for mold because any moisture that gets inside the vinyl is staying there. There's no way for it to really escape. And again, that's why water damage is such a serious deal. And the problem is that water damage is usually in places you can't see. So it's truly a hidden thing. But sometimes there are ways to detect through our senses that mold's an issue. I mean, has everyone smelled mold and what it smells like moldy food? I mean, there is an ability for some people to detect mold, but the problem is it happens so slowly and insidiously that oftentimes we're not aware of it. But sometimes we can be, and patients often will come in and just say, my house smells moldy, or it smells like mothballs, or often they'll say, when I leave my house or go on vacation, my symptoms get a lot better. That's a big clue that there's something toxic in your environment that needs to be addressed. So those are some of the clinical questions you can kind of ask. There's different types of mold. I'm not going to go into them. There's probably a few dozen molds that can be problematic. Everyone's a little different. Arguably, you might be able to treat them a little differently, but generally the methodologies that I use are going to be pretty similar across the spectrum. So you can do mold testing, inspectors, people who do remediation, and they come sample air supplies, and then you can basically have those assessed, and the spore count determines how significant of an issue it is. So that's the environmental testing. The other type of testing, of course, is there a way to know if there is mold in the body? So you can actually, if it's in the sinuses, if it's in different tissues, you can actually go and culture molds, and there are ways to do that. There are labs in the area that will culture different secretions in your body and assess the mold. There's also urine tests for mold metabolites that you can do. It's very difficult to test for it in the blood because we can't really make a lot of antibodies to mold, so we're not going to see a ton of those. But we can test urine metabolites of those mold toxins. So that's a test that I have access to, and on rare occasion I might actually run those. So, any questions about chronic mold and mold stuff? Okay, cool. So another one, there's two more I want to mention, and they're things that I've done like entire lectures on. So I'm not going to go into a lot of detail, but they're a really big deal in terms of this topic of chronic infection. So the first is dental infections. I am the son of dentists, so this one is something that I really care a lot about and think a lot about. But our teeth, in kind of all the way up to a couple hundred years ago, really, dental infections were one of the leading causes of death for humans. Basically a tooth dying and bacterial infection going into the root of the tooth and then spreading systemically into the bloodstream. So it turns out that still happens, and especially with folks who have root canals, it can be an exceedingly common thing, that a root canal is essentially drilling the center of a dead tooth out and then leaving the dead tooth in the body, and kind of basically with the assumption in the conventional dental world and medical world that once you drill the infection out and do the root canal, that the infection's gone. Well, in truth, teeth have these microtubules that can harbor infection in hundreds and thousands of them. So when you drill the center of a tooth out and you leave the remainder of that dead tooth in place, you're definitely almost guaranteed going to have infection happening in there. And essentially that infection can eventually drip through the root into the bloodstream. That's one example with root canals, which is again, insidious, hidden form of infection. But you can have all sorts of bacterial, essentially, pervasion of the tissues and of the bloodstream, even without that going on. And the most obvious is when you have an actual abscess tooth, when you have a tooth that has not been taken care of, that has had decay go all the way into the inside of the root of the tooth and then moved into the bloodstream. And of course, we would hope that most of the time there would be a lot of pain around that, but it's amazing how often I've talked to patients about dental care and crumbling teeth and how that still goes on plenty. And there's a lot of reasons behind how it gets to that point, but just to say that, dental infections can be really obvious too. Again, the key with the systemic chronic issues with tooth infections is that it needs to spread into the root to really cause the most adverse consequences. But again, if you have really inflamed, damaged gums, again, makes it much easier for those pathogens to access the roots and get into the bloodstream. So I did a whole lecture on dental health and getting to the root cause of chronic diseases. I'll refer you to that if you want to learn more about it. But, it's just something to say if you've had significant dental work done, or if you have some of these chronic symptoms, fatigue, heart disease is a big one with chronic dental infections, autoimmune disease can be a really big one with dental infections. If these are going on, that might be something to explore. And the way to explore that might be with a holistic dentist, or a biological dentist as they call them. Certainly it's something that I explore with my patients when I'm suspecting chronic infection as part of the picture. But that's something to be aware of. So any questions there? Okay, cool. So in the last area of chronic infection that is probably the most prolific in my practice is gut infections. Parasites, bacteria, these are vastly underdiagnosed in the conventional medical setting, and they're major players, culprits, contributors to a lot of chronic diseases. This is a pretty big deal because our gut has a lot going on, and it's really where our immune system kind of lives is in our gut. So how healthy our immune system is directly associated with how balanced our gut is and how friendly or unfriendly of populations of bugs we have there. It's also where we break down and extract nutrients that we need to live. So if we're not breaking down and assimilating things efficiently, that's very problematic to our long-term vitality and health, because if we're not getting the nutrients we need, or if we're incompletely breaking down compounds and they're becoming reactive in our systems, that's a big problem. And so in the gut, you have an interesting situation because you have all these microbes there, right? They're supposed to be there. And you have fungus there, and you have bacteria there, and you have parasites there, and you have viruses there. And they're all in a healthy individual living in co-harmony in this ecosystem. But things happen in our life to disturb that. We have stressors, physical, emotional. We get food poisoning. We drink unclean water, and we can start to invite and encourage pathogens that either are not supposed to be there in high quantities or aren't supposed to be there at all, kind of take over the terrain there. And what often accompanies that is disruption and breakdown of the protective intestinal lining. So the toxins from these microbes and even the microbes themselves can move themselves into the bloodstream and cause all sorts of systemic issues. So with gut infections, you might think obviously symptomatically, well, do you have gut symptoms? Do you get bloated? Do you get constipated? Do you get heaviness after meals or fullness? Do you have abdominal pain, right? So these can totally be there with gut infections and often are. But a lot of times you don't necessarily have those things, or you've had them for so long that you don't even pay attention to them or think of them as normal, and you get other issues. Again, I'm going to sound like a broken record, but fatigue, brain fog, pain, inflammation in the joints, headaches, allergies, chronic sinus congestion. I mean, honestly, I really think that any symptom expression, it's possible for it to be linked on some level to what's going on in the gut. So that's why, again, I've done big lectures on this topic, because it seems to be pretty prolific and epidemic that working on imbalanced gut bugs can be really helpful. And so, again, testing for that, conventional medicine, not my favorite kind of, I guess, vigilance around understanding this. Most of the time they'll do a stool test. It's a culture usually. It's usually one single sample that's done. And a lot of times things will be missed. Plus, a lot of these gut infections, it's way more tricky because our gut's full of bugs. So it's not even necessarily that the issue is about having these really bad pathological infections. It's about imbalance of the normal flora, or it's about a type of bug that's supposed to be there in small amounts being there in way too high amounts. And so I would say here's a place where the conventional community just really does not have the expertise that I think some patients need. And so what I'll do is I'll do a lot of careful clinical case taking of symptoms, which is a big part of my practice to understand this gut picture. And then in some of the more tricky cases, I'll actually go ahead and test the stool, and I'll test it with much more advanced parameters. Like I'll actually use what's called DNA probes or DNA replication. So we're not just looking for culturing the microbe, we're looking for the existence of the DNA of the microbe and the quantity of the DNA that's there. In addition to all sorts of other intestinal permeability and intestinal function, we can do a lot of that in these tests. So that is something available, and on rare occasions I use those tests. So again, something that's all over my past video lectures in different snippets if you want to go into more depth, but generally gut infections are a major source of chronic disease, and that's kind of the mechanism of how they work into systemic symptoms is the gut lining gets compromised and those toxins or microbes actually get into the bloodstream. So any question there with that topic? Okay, so let's switch gears and get to the exciting part of how do you understand this chronic infectious disease in the context of health, and how do you go about treating it? And so I want to introduce a premise of health that's very near and dear to my heart, and I passionately feel to be really true, which is the terrain theory of infectious disease. So what most of us are familiar with is the infectious theory of disease, or I should say the microbial theory of disease. And both of these theories were developed a few hundred years ago. Everyone's probably familiar with Louis Pasteur, who developed the microbial theory of disease, but not many people are familiar with his contemporary named Claude Bernard, who came up with the terrain theory of disease. And the difference between the two is that the infectious theory of disease, or I should say the microbial, is that microbe equals infection. That's the first theory. The second theory, Claude Bernard's theory, the terrain theory, is that microbe plus susceptible terrain equals infection / disease. And really what we should actually say is disease, because disease is more accurate. Disease is kind of connoting that there's a pathology. So this is very big, in my opinion, when we're talking about acute disease as well, right? Like coronavirus. So what our healthcare system is running off of the premise of is, if the microbe is present, you're going to get the disease. So the solution we've all been presented with is isolate yourself, because if you get exposed, you're going to get the disease. We know that's not really the case with viruses. As we said in the beginning of the talk, there's millions of viruses in this room, on our skin, there's bacteria everywhere, but we're not all sick, right? So why is that? Because the microbes are here, but we don't have disease. So the variable that is so important is the terrain, right? This is what we can manipulate. This is what we're in control of. This is the part around our health that we have the power to influence. I mean, of course, there's sanitation techniques of, if someone's sick, sharing saliva, and, washing your hands, not being in massive crowds if there's a pandemic. I mean, for acute disease, this all makes sense. But there's this other piece about, are we susceptible? And what I talk about in the susceptibility piece is the terrain. And the terrain is basically translates to, our individual health in terms of the variables we're in control of manipulating. And they're really basic things. There's not rocket science. I mean, they're not like these profound things, right? They're adequate rest, right? Good sleep, hydration. It's amazing how being hydrated will improve immunity and prevent the spread of infectious disease. It's having good circulation. And what's good circulation about? Well, a lot of it's about exercise. Moving your body every day regularly like our ancestors did, not sitting on a couch in a chair, continually. It's about getting good air and breathing, right? Actually breathing into your belly and taking deep, full breaths. It's about eating real, vital, live foods, whole foods. It's about digesting your foods efficiently. It's about eliminating healthily through your eliminatory organs, so that any toxic burden your body acquires, it can mobilize that efficiently. And we're going to talk more about that because I think that's a big, big deal in these chronic infectious diseases. It's about stress, psycho-emotional stress primarily. It's about our spiritual, mental, and emotional well-being. It's very clear that when someone is stressed, their immune system is suppressed. And if our immune system is responsible for protecting us from infectious diseases, then unprocessed stress that's chronically being engaged is very destructive for these chronic infections. It is in linkage to stress, of course, our history of disturbance is a pretty big deal there too. So a lot of our stress comes from the patterns of how we've grown up learning how to relate to the world and adapt to stress, or how we deal with or don't deal with stress, or what we choose to be stressed about. So it's, you know, when I'm working with a person and I say, we need to work with your stress response or your psycho-emotional realm, I mean, that's a can of worms to open up, right? But it's very necessary we sometimes do that, because helping someone process old traumas or react to situations differently or develop habits that ground them and keep them out of a chronic stress response can be powerful to how it influences their health. And that same thing goes for chronic diseases that are infectious, because when we're in that activated stress state, we definitely shut down that response. And as we mentioned a little earlier with some of the pathogens, environment, right? So being thoughtful to your environment, having lots of fresh air, not being in toxic spaces, not breathing in fumes, not cleaning your house with chemicals or putting chemicals on your body, not eating devitalized foods that have all sorts of preservatives and, you know, synthetic substances in them. So I would say that 90% of the work I do with people, that's it. You know, with these in these chronic infectious diseases, that's it. Because if we can make the terrain inhospitable to the microbe, then the microbe cannot thrive. So with all the infectious diseases we talked about, I would say that arguably we either are all hosting some of them or have been exposed to all of them. But nevertheless, if we care for our vitality, our terrain, we're not going to express that microbe, or that microbe is not going to be able to proliferate in our body or kind of disrupt our well-being. And so, you know, it's very common that I'll see people who've had positive Lyme diagnoses in terms of workups that have no symptoms. And I would argue that the case there is that they're determining forces of health and how they're stewarding those and how their body is, you know, essentially keeping that microbe in essentially a constant state of inactivation is really why they're not symptomatic. And so that's a big thing when we talk about some of these chronic infectious diseases. You know, cure may not mean complete eradication of the microbe. It may mean just permanent resolution of the symptoms. So I want to differentiate that, because I think that's very true. Same thing with autoimmune diseases. Autoimmune is when the immune system is attacking itself. Well, cure is not necessarily that you'll never ever, you know, be positive for autoantibodies, antibodies towards self, kind of like antibodies to infections, but that your health is well balanced to the point that you no longer express any symptoms. So just want to make that clear, that I feel like cure does not necessarily equal eradication of the microbe. Cure may equal freedom from limitation in your health. And that's why I keep using this term, limitation, in how you are able to experience life, because that's really a pretty broad definition of health. So working on those determining forces is a really big deal. And I would say with these chronic infectious diseases that one of the biggest mistakes I see people make when they're trying to treat these infectious diseases is, the chronic ones, is not getting their eliminatory organs working well before they try to kill the bug. Because when you kill microbes, they don't like to die, so they protest a lot, but also when they die, they release all sorts of metabolites and toxins as they're dying, and your body has to deal with those and process them. So if you aren't up to that task and you're not in an efficient mode to do that, then it can cause all sorts of problems. So the first part about elimination is good circulation, right? If you're dumping toxins into the bloodstream and the blood is sluggish, you're not having really healthy circulation, then you're not getting those toxins to the organs of elimination. In the bloodstream, the blood vessels kind of are working in tandem with our lymphatic system, which is a form of a communication network right side by side with the bloodstream. So moving the blood, moving the lymph is really important. So exercise becomes a huge deal, right? Because pumping your muscles pumps the blood. I love hydrotherapy, which is alternating hot and cold to the skin surface. Really good way to vigorously move the blood and lymph. I like dry skin brushing, which is a way to just brush lymphatic fluids, often towards the heart is what I recommend, to kind of get that lymph mobilized and get those toxins and immune cells moving. Yeah?
Question about that. So I do that, but is it just like, I know you said the whole process takes like 30 seconds to a minute.
Yeah.
Is it like a few times in each direction or just one time?
Yeah, I would just say a couple of times, kind of over each surface of the skin, moving towards your heart.
And that really just helps. I mean, sometimes it seems like, is this really doing anything? But like, that really just, what is it doing?
Many of our lymphatics are very near the skin surface. So it's a great way to move that lymphatic tissue and fluid. Now there's more like therapeutic ways to do it, like therapeutic massage, and people who are educated in the lymphatic system and know how to move lymph appropriately, to drain it appropriately. That's another great way to work on circulation and lymphatic movement. So a lot of folks with these chronic disease presentations and chronic infections, I really want to work on circulation, lymph flow, blood flow. Then downstream, we have to look at the eliminatory organs. So we're looking at the liver, we're looking at the colon, we're looking at the lungs, we're looking at the kidneys, we're looking at the skin. So for a lot of these folks, sweating therapy and getting them to sweat is huge. Getting them to be hydrated enough, to drink enough water to where their kidneys aren't taxed. Getting their livers decongested, whether that's cleaning up the diet in the gut, whether that's doing castor oil packs, which is a really good way to stimulate the liver, whether that's using compounds to support the liver like dandelion and burdock and turmeric, milk thistle, N-acetylcysteine, a lot of great compounds we can work with the liver around. But decongesting the liver can be hugely important. And then breathing, belly breathing, fresh air. A lot of people shallow breathe, really good way to exchange nutrients. And as I mentioned, the skin, sweating. So these are some of the big things I really want to focus on. And if I can't get those things really opened up, I'm going to be really hesitant to go try to treat and kill the bugs. Because as those toxins dump, then they have nowhere to go. And they keep recirculating and make the person feel worse often. So that's something really important to kind of hone in on. I think as a general theme, one of the big things to address is just toxemia, or toxic accumulation in the tissues, and really what the sources of that are. So again, my sense is someone might have a chronic infectious disease, but they side by side have a really impaired, compromised gut lining. And so they're constantly building a toxic burden in their body that is distracting the immune system, that's creating essentially a soil for microbes to land on and thrive in. So I really think that tidying up the gut, healing the gut lining, putting the appropriate foods in the diet that the body assimilates well, whole foods that are going to be used as medicine, not as a toxin, is really crucial. So the gut part of that is a big deal in terms of how toxic accumulation happens. So, what I'm describing here, one of my most powerful therapeutics and treatments is detoxification and fasting. So any chronic health disease, whether it's infectious or not, it's one of my go-to tools. I love removing toxins from the body and preventing the intake of toxins. So The most aggressive way to do that is to fast, to do that in fasting programs. I do a fasting program every fall and spring with the community, with patients. I also individually guide patients through fasting programs and detox programs. I would just call it a really aggressive way to reduce a person's toxic burden, which allows their immune system to work better, and which removes the soil through which the microbes, the infectious compounds, are allowed to live and thrive in the body. So I think on a real fundamental level, that's one of the best things we can do. Yeah.
Would you include intermittent fasting in that category, or like the big detox juice cleanses?
Intermittent fast, so that's a good clarification. And detox can be as simple as saying, all right, I've been drinking a 6-pack of beer every day and I know that's not good for me. I'm going to stop doing that. Well, it's a form of detox. It's gentle, but it's still helpful. So really, like, the whole concept of detoxification is identifying what is toxic to the body. And that can be a collaborative effort with the patient and the doctor, or it could be something the patient just becomes aware of. Oh, I know these cigarettes are toxic and don't help my immune system or my, my body. So really, any sort of withholding from something that creates toxemia is a detox. And so it's all a spectrum, and it's all about where you're at, right? I meet everybody where they're at. So if it's like, oh yeah, doing a juice fast, but no one can do that, I say, well, how about we do this, and how about we work on this thing? So, health is it's a lifelong journey, and so it's really important that we understand that, especially with chronic disease, the stuff's been here for a while. It's going to take a while for it to go away, and time is not the variable that needs to determine how we approach this. A lot of people have very deep-seated attachments to their habits, and changing habits is really hard. And really, what I'm arguing here is the way to treat infectious disease or chronic infections is, for the most part, on a habit level. We need to change the chronic patterns of living that are creating a susceptible terrain to microbes. That's my fundamental answer. Now, in a minute, I'll get into a bunch of specific things, but I firmly believe if we don't do that work first and foremost, or we're not doing that contemporaneously with more specific treatments, that infectious disease is never going to be cured, if that makes sense. So those are kind of some of the real biggies that I want to mention. And again, I just want to spend that minute talking about the linkage between the immune system and stress, right? So if we're chronically stressed, if we're constantly in fight or flight, we are constantly curbing the action of our immune system. And it's our immune system's job to clear those chronic infections. So if our immune system shut down, it's going to be really, really hard to remove and put into remission or into a place of inactivity these infectious microbes. Okay, so those are some pieces just to kind of mention to everybody, and I really do think, for me, the success I get with chronic infectious disease is 95% there. And one other big thing to mention in that realm of toxicity is blood sugar, right? So bugs, most of them, fungus, bacteria, viruses, they eat sugar. So if our blood sugar is dysregulated, then we are way more susceptible to the chronic effects of infectious pathogens. If we have a really normalized, balanced blood sugar, if we're not putting a bunch of starches and sugars into the gut, it's a much less hospitable environment for infectious compounds because they require sugar or starches to feed their metabolism. So that's one of the best things we can do is balance our blood sugars, primarily through nutrition, but also through exercise, as a way to mitigate the activity of that. So when we get into specifics, then I'm starting to draw upon some of the tools that I found to be helpful when the body is ready and has enough of a foundation to go after some of these bugs that are sticking around. And there's no right way to do this. This is just my experience. So in general, herbal medicine can be very valuable because herbal medicine can be both destructive to not only bacteria, but also viruses and also fungus. And so there's different compounds for different types of infections that I find to be really valuable. And there's some compounds that work seemingly on all of it, like garlic is an example of something that works on fungus, virus, and bacteria. Oregano is also a compound that seems to work on all of them. Some seem to work more particularly on viruses, like licorice works really great on viruses. Lemon balm works really well on viruses. Some work better on bacteria, like golden seal works really good on bacteria. Andrographis works on both bacteria and viruses. And many of them in the herbal world are great because they don't work on one or the other, they actually work on both. So if we're not sure about whether it's bacterial, viral in origin, we can kind of cover both bases. I really like OSHA as another good compound. I really like bloodroot. I really like echinacea. So these are, again, very good antimicrobial compounds that can have really good efficacy. Another big category of antimicrobials I really like to work with are medicinal mushrooms. Mushrooms have a really powerful immune engaging action. And actually I should specify the means by which these medicines are working are usually quite different than drug-based antibiotics. What we find is with mushrooms and herbs, a lot of the activity is to stimulate innate immune activity or adaptive immune activity. So it's basically to prop up the vigor and intelligence of our own immune systems, which is pretty cool, right? Because we're not suppressing, or we're actually empowering the body's own healing ability. And that's always what I really, I'm seeking to do with each case I'm working with. Again, mushrooms, not all products, and this is true with all natural medicines, are created equal, so I'm pretty picky about which mushrooms I'll use. The one that I really like is called JHS. There's also one called Host Defense that makes pretty good mushrooms, and I use a whole host. I use reishi, turkey tail, agaricus, lion's mane, cordyceps. There's lots of really good mushrooms that do a great job immunologically. I will use different forms of herbs in different potencies. I'll use some really potent formulas, like one's called biocidin. It's really concentrated. Thanks for coming, guys.
Sorry.
Yeah, it's okay.
Thank you.
And I'll also use gentler herbs, and again, it really depends on the individual and how much they can handle. So oftentimes I'll need to build up the antimicrobial slowly, and sometimes I'll need to take breaks. So that's very commonly the way I might approach it. Also, some of these microbes will mutate and become resistant to different antimicrobials. So we'll often require that we either alternate them or switch antimicrobials when we're treating with those. So something to kind of just keep in mind in approaching this. It's not just, oh, you have this infection, you need this medicine, and just take it until it's gone, your symptoms are gone. It's usually quite a bit more complex. Something I also want to mention is the adrenal gland. And so the adrenal glands are one of the supportive organ systems that have a lot to do with immune function. So in these folks with chronic infectious diseases, oftentimes the adrenal gland, which is responsible for our stress response, has been very compromised because the infectious disease itself is a stressor to our body, chronically having that. And so the adrenal glands can get really tired, but often all of those fundamental health determinants have also compromised how that stress response works in our body. So I find with those patients, it can be really helpful to support the adrenals, which again in conventional medicine is something that's just missed a lot. So working on that can be really helpful. I guess, I could go into specific products and stuff that I use, but I think that's, a little overkill. I'd rather just leave a little space to answer questions and check in about where we're at in the lecture. So, yeah. What were you?
Is that what you meant, is like going into specific products, like how do you treat the adrenals? Like, is there something you do or use, or is it mostly
Lots of different things. So, herbs again. There's some really great adrenal herbs, Asian ginseng, American ginseng, Siberian ginseng. I like to use licorice in that world, especially with low blood pressure. Cordyceps as a mushroom's great. Ashwagandha can be great if it needs to be calmed down. I like to use glandulars. Those are actually adrenal extracts. I like to use basic nutrients like magnesium and B vitamins. So, and again, I've done a couple video lectures on the adrenals as a specific focus. So there's a lot to that if you want to kind of dig in that. Rhodiola is a good one, yeah. Yeah, that's all right.
What causes a distended stomach, and how do you treat it?
Lots of things can. So I think that, you can have really serious things cause a distended stomach. Like you could have, your abdomen filling with fluid. It's a very serious disease. Most people have a functional issue going on. They might have a gut infection. They might be reacting to different foods. The term I would use is bloating, a lot. Parasites can be an issue. So there's really a lot of causative things. Malnutrition can cause a distended stomach.
Could gluten cause it?
Reacting to foods like gluten, absolutely. Yeah. And treating it might be figuring out what's offending it and avoiding it, or it might be more in depth in dealing with gut infections and those kind of things. Yeah, so any other questions about just this topic and kind of a naturopathic perspective of how to approach it? Cool. Okay, awesome. Well, I'm gonna kind of, for that portion of our chat, pause it there. I think that's a good stopping point, and definitely open for any additional questions, of course. But let me kind of get through these questions for you guys, because I think most of us are still here, except the finance question.
Yeah, pass it along.
Okay, cool.
They all have young kids.
No, totally. So, making up sleep, I think you can kind of make up sleep, Randall. I don't think you can completely make up sleep, but there's definitely good scientific evidence that, sleeping for 12 hours after a week where you've only got 5 hours of sleep, people anecdotally will tell you they feel more rested and they feel like they've caught up. Theoretically, the body goes through a circadian rhythm and it has several cycles of sleep. And there's deep sleep, and there's REM sleep, and there's light sleep. And to get into those deeper layers of sleep where the most regenerative actions happen, you need to sleep for a significant amount of time. And if you're not doing that every night, then you can't, in one night or in a couple of nights, make up for a week's worth of not getting that REM sleep or that deep sleep. So I think it's just like, yeah, you can catch up to some degree, but never completely, because like anything in the body, we're dealing with an equilibrium, and if you stay in equilibrium, it's way better than swinging from one end of the pendulum to the other. It's just more efficient. So if you go with no sleep for 3 days, then you sleep for 24 hours, the equivalent effect is not to have the same level of vitality and health. But I think it's better to not sleep for 3 days and then sleep for 24 hours than just not sleep at all, right? So there's, there is a benefit to catching up to some degree.
Good part of it, it'd be psychological. If you just...
Sure. And what do you mean by part of it being psychological?
I was sensing that physically you probably couldn't make up the equivalent of what you've lost, but you might, feel like if you slept extra, it might
Sure.
feel like it.
Yeah, I think it could be psychological on some level, but I think it's physiological too. I think if you sleep a whole bunch after not sleeping much, it definitely physiologically is restorative. Yeah.
Can I add something to that?
What's that? Yeah.
I was just thinking the danger kind of with your body and the brilliance that it is can actually get used to certain circumstances. So if you, for a chronic amount of time, are only getting 5 hours of sleep, your body will actually adapt to that, where you feel like that's all you need. And that's where I think it's difficult to make up, because then to shift to restorative sleep, you're actually doing something against what your body's used to. And that's where I think the tipping point is in being able to make up what you've lost physiologically in that sleep. So if you are lacking sleep, try not to let it go to the point where your body's saying, oh, this is our new normal, we'll adjust to that. And that's where you really are losing that restoration that happens in that sleep cycle. If that makes any sense. We're brilliant, but we can be our own worst enemy if we keep putting ourselves in situations that are harmful.
Yeah, great point. Thank you. So health and finances, I mean, the big thing that I would just, first think about is food as medicine. You don't need to buy organic food to eat whole foods. Unfortunately, it can be a little more expensive to eat whole foods, which is crazy, but frozen food can be super healthy. Canned food can be pretty healthy. You don't necessarily need fresh, organic veggies to get health. Whole grains, whole beans, whole nuts and seeds. Nuts and seeds are a little more spendy, but I mean, those are pretty inexpensive foods. And I would argue that a healthier diet is pretty low in animal products, which are the most expensive things. So just from a food as medicine alone, that's a really good way to be healthy with little finances. And I mean, it's just, again, it goes back to determinants of health. You don't need some fancy bottled glass water to be hydrated. You can drink tap water, and that's a huge part of health. We were just talking about sleep. So I guess my answer to that person would be really following the determinants of health and realizing that none of the determinants of health involve taking medicines, buying expensive supplements, being a member at a club. You can go walk out in the park. So it's just really, to me, the education piece is so key of like what does inform our health. Like, how I relate to stress really makes a difference. A lot of people don't even realize that that's linked to their physical health. So I just think I would kind of go down those lines to speak about that. Anything else you would want to put in, Dr. Karen?
No, I think that. I think the advocacy for we're going through this right now, the systemic inequity in healthcare as well.
Yeah.
So I think if somebody does feel very passionate about this, I think getting in a political level is really important too. So writing letters to politicians to make health equity a thing and access to healthcare.
Totally.
Is really what we're seeing.
Yeah.
Well, and I think too, once you start feeding your body and your body starts getting the nutrients it needs, you're not putting all that extra stuff in. And processed foods can be a lot less expensive, but you're also having a lot more of it for the body to actually even try to get a little bit of nutrients that,
That's right. Yeah, and it takes so many nutrients out of the body actually to process those foods.
Right, and so I think, once you do start actually eating a little bit healthier, it just seems to...
It's definitely, to me, the most accessible thing to choose is, food, and be educated about what real food is and the proportions and all that.
Right.
And your question, Jacqueline, was for anti-aging. Are you like really looking for like something you could take, or like the lifestyle thing that matters the most, or I mean, it's such a hard.
It is a hard one, I know. It's really a curveball. I mean, obviously, all of these things that we've been talking about will affect all these areas. But I think just as an Asian.
I mean, I think like some of it's genetic, right? So you definitely have to deal with that. That you're just going to physically age at different paces. I honestly would say that if I had to pick one thing, gosh, it'd be like a toss-up between, laughter and a really healthy, integrated mental, spiritual, emotional way of living in the world and living in a space of gratitude and joy. I think that would be like the one half of what I'd like be like arguing, and the other half would just be like really having great assimilation. So barrier function of the gut, breakdown function, ability to really uptake nutrients efficiently, which would kind of tie into like which nutrients you're uptaking. But I think
as far as like topically, like skincare wise, that's such a broad thing. Obviously staying away from toxic products.
Yeah, I mean,
stuff, but I mean,
to me, topical is like, it is, I mean, sure, there's like, it's good to have hydrated skin, but I think skin hydrates from the inside out primarily. So there's some things you can do, but we are, by definition, everything that illuminates our